Hi, welcome back as we continue our exploration of some structures, specifically relating to muscles in the shoulder and the upper extremity. So let's start with the shoulder first. And by the first muscle here in the shoulder is one we've known about our whole life, and this is the deltoid muscle. Now, the deltoid muscle is one of those muscles that actually goes in 3 dimensions, so that the actions of the anterior fibers would be like flexing the shoulder, whereas the posterior fibers would be doing the opposite action of extension. And then those lateral fibers would be doing abduction. So please pay attention to specific fiber actions. The entire deltoid is going to insert in one common location, as can be seen in the cadaver and model pictures, and that is in the deltoid tuberosity, approximately halfway down the shaft of the humerus. Now, the rest of the shoulder muscles are all attached to the scapula. So let's start with the posterior aspect of the scapula. Above the spine of the scapula, where we have the supraspinous fossa, that is completely filled up with one muscle called the supraspinatus muscle. And as you can see, part of it will be covered by the deltoid muscle, but a lot of it is exposed. So the supraspinatus muscle actually inserts way over here on the very top part of the humerus. So it's going from a superior aspect of the scapula to a superior aspect of the humerus. So it's helping to stabilize the shoulder joint, thereby making it one of the 4 rotator cuff muscles. Below the spine of the scapula, we have multiple muscles. The major muscle is called the infraspinatus muscle, filling up the majority of the infraspinous fossa. And it is a posterior scapular muscle which inserts onto the posterior aspect of the greater tubercle of the humerus. And so this is also helping to stabilize the shoulder, thereby making it the second of the 4 rotator cuff muscles. Just inferior to the infraspinatus, there is a muscle whose origin is slightly more lateral than the infraspinatus, and this is a small round muscle known as the teres minor muscle. And as you can see for this muscle, when the deltoid is present, all you see is a tiny little portion of the muscle. But once you take off the deltoid as well as get rid of the triceps muscles posteriorly, you can see that this posterior scapular muscle also inserts posteriorly onto the greater tubercle of the humerus. So this is the third of 4 rotator cuff muscles trying to increase the stability of the shoulder joint. The lowest part of the posterior aspect of the scapula is the origin of a third muscle below the spine of the scapula. And this one is a round muscle that is significantly larger than the teres minor muscle. So this is called the teres major muscle. But you need to look to see what this muscle is doing. This muscle, as it goes towards the humerus, dives anteriorly. So as opposed to the infraspinatus and the teres minor, which have posterior attachments of the humerus, the teres major dives anteriorly and actually has an anterior attachment of the humerus, thereby giving it some rotational motion, but not adding to the stability of the shoulder joint at all. Thus, this one is not a rotator cuff muscle. Those are the muscles that are coming off the posterior aspect of the scapula. Now, on the anterior aspect of the scapula, that entire subscapular fossa is going to be filled with one muscle known as the subscapularis. and the subscapularis, which is anterior to the scapula but behind the thoracic cage, does insert anteriorly onto the humerus, thus trying to stabilize the shoulder joint. So this is the fourth and final rotator cuff muscle. So with that, we are done with the shoulder muscles. However, I am going to continue on this same video and do the arm muscles because there aren't that many arm muscles. And by arm, we're referring to the anatomical arm between the shoulder and the elbow. So let's start with the anterior muscles. The first muscle is a very little thin slip of a muscle which actually the name is one of those names that's giving you the origin and the insertion in the name. So remember that the origin is first, then you can realize the origin of this muscle is the coracoid process, the scapula, and the insertion, brachial means arm, so the insertion is going to be in the midshaft of the arm, or in other words, the midshaft of the humerus. So this is a little slip of a muscle known as the coracobrachialis. Where you see the coracobrachialis very prominent is when you have somebody outstretched as if they were being crucified, and you can clearly see it right here in the upper axillary area. The muscle that all of you enter this class knowing is the next muscle, the biceps, but you can't use that anymore because we have two biceps muscles in our body. So this one in our arm, the anterior aspect of our arm, is known as the biceps brachii with two eyes on brachii. So this is a muscle that has two heads. There's a short head and a long head. If we look at the picture of the cadaver, the long head is the more lateral one, and it is going through the intertubercular groove. Okay. So the biceps brachii is a great muscle. Only the long head will have any effect on shoulder movement, as in flexing the arm. The short head doesn't have that activity. However, both heads have a common insertion. And so both heads will have to do with elbow flexion. So this is one of the major muscles, one of the synergists for elbow flexion, but it's actually not the prime mover, even though your entire life you have been giving credit to the biceps brachii. But most of that bulge is caused by a muscle which is deeper to it. So if you look at this picture with the blue background, you can see the biceps brachii is the superficial muscle, but then there is this thick muscle that you can see deep to it in the distal half of the arm. And you can see it as well here on the entire upper extremity model. So this is looking at it on the anterior view where you can see the coracobrachialis and the biceps brachii, and then this third muscle. And if you look at the posterior view, you can clearly see the deltoid, and the biceps brachii has the arrow, and then just deep to the biceps brachii, this big thick muscle, that's the prime mover for elbow extension, and that muscle is the brachialis muscle. So the brachialis muscle has its origin about about halfway down the shaft of the humerus. And it's going to be the prime mover for elbow flexion. And so the difference between the brachialis and the biceps brachii for insertion is the ulna versus the radius, respectively. All right, now that's it for anterior muscles. There were 3 of them, and posteriorly there is one muscle with 3 heads known as the triceps brachii. So it's super important on models that you can find all 3 heads. So I've pointed them out here. So what you need to do first is realize this lateral part, that's all lateral head, okay? So everything you see on the lateral aspect is called lateral head. And so then on the medial aspect, that's where you see two heads. And the big one is not called the medial head. The big, more proximal one is called the long head. And then the one closer to the elbow, which is significantly smaller on all the models, that is called the medial head. So you can see this on the cadaver. This is a posterior view. So this big, huge muscle that you were seeing posteriorly, that is the long head of the triceps brachii, and then distal to it on each side, that is the medial head of the triceps brachii. And you can see just the distal sliver of the lateral head right where it is inserting into the tendon of the triceps brachii muscle. So with that, we are done with shoulder and upper extremity. I want to thank you, and I will see you again soon as we continue with our second video, which will be anterior forearm muscles.